If you're a woman between the ages of 35 and 50 and are having new symptoms like mood swings, insomnia, anxiety, even hot flashes or skin changes, then you need to watch this video today. We are going to talk about the changes that happen between these ages, potentially of 35 and 50, and it's called perimenopause. So stay tuned to learn more. If you want to learn more about your hormones, hit the subscribe and the bell to be notified when I post new videos every Friday. If you're new to this channel, welcome. I'm Dr. Shelley Meyer. I'm a functional medicine physician, board-certified family physician, and registered dietitian nutritionist. And I help motivated women get to the root of their hormonal imbalance and start thriving and reclaiming their feminine energy again. So let's talk about perimenopause. It's often a word that women are afraid of because they feel like it means that they're actually in menopause or getting old. That's not really the case. Let's talk about what is perimenopause. Well, perimenopause are the years that lead up to menopause, which officially is when you go for 1 year without a period. Now, perimenopause can last anywhere from 2 to 10 plus years. So that's why we're saying it can start at as early as 35. Now, that's not the most common age because the average length of perimenopause symptoms is about 4 years. So let's say your mother went into menopause at like 52. Then you may start it. If you were average, or if you had the average length of it, you may start it at 48. But there's lots of variables. You don't always go through menopause the same age as your mother did, and your length of perimenopause could be longer. So perimenopause, though, is officially the years leading up to menopause. And menopause is when you've gone a year without a period. Now, there are different phases of perimenopause. I'm going to put a graphic here. And so you can see that there's different phases. You can start with the first phase, which is shorter, and then go into a longer phase, and then another shorter phase. And then you'll see the hormones go kind of up and down like they are on the graphic. Now, not everyone goes through all of the phases, and not everyone goes through them at the same amount of time. Some people, the first phase may last longer, the second phase may be shorter. So just keep in mind that there's a variation, just like with everything with your hormones. So you may not hit all the marks here. Now, let's also talk about how you would feel if you were in perimenopause. So these are just, I'm going to first talk about some of the most common things you might feel and the most common things I hear from women, and then cover some of the less common ones that you still see. So mood swings, I hear a lot of that from women, and I've had those myself. New onset depression, anxiety, irritability, kind of up and down, and kind of riding that roller coaster like we're talking about. Insomnia, that's one I've suffered from a lot in my phases leading up to menopause and perimenopause, or within perimenopause. And it's mostly described as that I wake up at 1 or 3 a.m. and I can't go back to sleep, 1 to 4 a.m., somewhere in that time frame. It's not usually like the onset of cannot sleep when you try to go to sleep. It's more waking up in the middle of the night is the one that's more associated with hormonal changes that are in perimenopause. Another thing you can see are hot flashes. So usually towards the middle to the end phases of that PDF that I showed before are when hot flashes and night sweats can come along, but they can really kind of fluctuate throughout the whole perimenopause cycle. Now, you can also have heavy periods that are mixed with irregular periods that don't come like they used to. They're more spread out than they used to be, or you can have heavy periods mixed with light periods. You can kind of have a little bit of everything in all the perimenopause stages. Another thing that I hear quite often that maybe women don't even know that's associated with perimenopause is dry skin or itchy skin. You can also have some rashes and some acne, but those are some of the ones that are less common, but just kind of a dry, itchy, crawling sensation almost you can feel in perimenopause. You can also have changes in your libido, so just not feeling romantic like you used to, not wanting to have sex like you used to. And there can be some dryness too that may contribute to that feeling. And then hair loss, women describe kind of shedding hair and not really patchy. If it's patchy hair loss, that's usually some other issue. And I have a whole video on hair loss. But with this kind of perimenopause type symptoms, it's more of a shedding kind of all over. And then also weight gain. That's one of the most common things I hear from women, and I've experienced that myself, that you just can't control the weight gain. You eat the same way that you used to, you exercise the same way that you used to, you even ramp up your exercise or you restrict your eating even more, and you're still gaining weight. And that's one of the signs of perimenopause also. Another thing I hear quite often is brain fog. So women may feel like they can't remember what they were going to say, trouble finding words, trouble remembering somebody's name, trouble remembering kind of frequent steps they do throughout the workday or something like that, or disorganizing their thoughts. That can be a sign of perimenopause and kind of the hormonal shifts that happen. And then other things that are possible, but a little less common, are palpitations. Some women can, maybe from the mood swings and the anxiety, feel some palpitations, or just separate from that. If they're not feeling anxious, they could also feel some palpitations. And palpitations are kind of that irregular heart kind of pounding. And some women may feel like they're having heart attacks and may present to the emergency room when it actually may be their hormones. I'm not telling you not to go to the emergency room. If you have palpitations, you have chest pain, anything that feels severe enough to go to the emergency room, then definitely go to the emergency room. And none of this substitutes for any advice from your healthcare provider. You need to, if you're having these symptoms, see your healthcare provider. And then also, like I said, rashes and acne and kind of other skin changes can happen. You can have more food sensitivities in perimenopause. There can be a variety, but the ones that I listed before are the most common. Now, if you're having any of these symptoms, please drop me a comment down below. Let me know what you've been through, because it helps other women that are going through this to know that they are not alone. Many women think they're going crazy, and their healthcare providers, unfortunately, aren't helping them through it. So if you can leave a comment down below letting me know what you've been through, or letting the community know what you've been through, that's very helpful to other women. And then also it can help me answer questions for you. Again, they can't be very individualized questions because I'm not your healthcare provider, but it helps me know what you're going through and try to help if I can. Now, how do you know if you're in perimenopause? Well, I wish there was one specific test that you could just go to your doctor's office and have that blood test and know that you're in perimenopause, but there's not. There are some hormonal levels that we can track to see if you're trending in that direction, if you're close to menopause, if you've already hit menopause. Those can be helpful, but when you're in some of the phases, the earlier phases, it's not easy to tell with lab work. But I do encourage you to discuss this with your healthcare provider and have them test some specific labs. And those would be follicle stimulating hormone, also known as FSH, luteinizing hormone, also known as LH, your thyroid, so TSH, free T3 and free T4, your estrogen, your progesterone. Usually estrogen is tested as estradiol, your progesterone, and your blood sugar. And the reason being is the FSH and the LH are messages that come down from our pituitary down to our ovaries to tell us to make more of the hormones. And that would be like the follicle stimulating hormone to make more estrogen, and the luteinizing hormone to make more progesterone. Those are just examples. But when you start to enter into the menopause, the end stages of perimenopause, those signals get louder and louder because the ovaries aren't responding. They're not making the hormones like they used to. So those numbers of the FSH and LH get higher and higher. And that's one of the markers we can use. Also, the reason I say estrogen and progesterone tests should be done is that we can look at your ratio and see if you're in some of those stages where your estrogen becomes dominant and your progesterone becomes suppressed. And I will list another video I have on estrogen dominance here too, so you can review that. So, and then the insulin, if your blood sugar is erratic and uncontrolled and you have signs of diabetes or early diabetes, or you just have, early diabetes could be high blood sugar that's not quite at the diabetes range, but is abnormal, then that can make this hormone roller coaster even worse. And then thyroid, if that's not controlled, or you're hypothyroid, it can mimic some of these symptoms and it can make the perimenopause symptoms worse. So you definitely want to make sure those are under control. Bonus tests, I would say, would be cortisol, checking that, but usually we do that with a salivary test. When you check your estrogen and your progesterone, I would recommend that you have it done between days 19 and 22 of your cycle if you're still having regular cycles. Now, if you're not, that gets a little trickier. So you can work with your doctor on predicting your cycles and trying to get the test done at the right time between day 19 and 22 of your cycle. So if you think you're in perimenopause, what can you do about it? Well, there's some lifestyle changes you can definitely do to make it a little bit easier and to lessen these symptoms. And I'm going to go into these more and more in detail in the upcoming videos. That's why I'd like to get your thoughts in the comments on what you'd like to learn more about in the upcoming videos. But some things, simple things you can do that aren't so easy to do, but that can make a big change in how you feel, are getting the sugar out of your life, trying to keep your sugar intake to 20 grams or less. Not including fruit, but you don't want to overdo it on the fruit. Just 2 or 3 servings a day is good. Eating high fiber, I talk about that a lot on this channel. So you know that I recommend 30 to 35 grams of fiber per day through your food, or you can use a fiber supplement if you need to on some days. Cutting back on your alcohol. So cutting it to 3 servings or less is preferred. Actually, preferred is cutting it out completely, but at least cutting it to 3 or less. Exercising daily, but not exercising too much, because too much exercise can stimulate that cortisol stress response, and then our blood sugar and our hormones can be more erratic. Eating organic, so getting out the pesticides. The pesticides can act as like fake estrogens, xenoestrogens, and make this hormone problem a lot worse than perimenopause. So eating as organic as you can afford and filtering your water to get those xenoestrogens out. And then talking with your provider. Now, if you have a provider who doesn't listen to you, is not taking this seriously, then find another provider, because you need to talk with your provider about what you're going through, and maybe get a functional medicine provider if you can afford it, if there's any in your neighborhood or you're in your area, to help you through this, because they can do some very specific tests to kind of get to the root of your individual symptoms and figure out how to balance your hormones during perimenopause. But I really appreciate you all watching today. What I want you to do is to leave me a comment down below to let me know what you're going through, and let other women know what you're going through. I also have a free PDF. Please check that out in the description below, because it's going to give you a cheat sheet to bring to your healthcare provider about testing and about the symptom checklist. So it has a perimenopause symptom checklist that you can bring along, and it just helps you kind of track your symptoms and talk with them about what labs you would like to have done and what symptoms you would like to get to the bottom of. So it helps you talk with your provider. So thank you so much for watching. Remember to hit the subscribe and the bell to be notified when I post videos on Fridays. And I'd love to get your comments down below. I'm Dr. Shelley Meyer. Thanks for watching.